Good morning, everybody. I'm going to probably post a few videos today after I get done editing them, but the first one I want to do today was inspired by a post that a friend of my wife sent her. This individual was going on a significant rant about conspiracy of the government and public health officials to go ahead and curtail your rights as American citizens, etc., and suppressing certain studies, etc. In any event, I will go ahead and summarize his Facebook video post and then go on to analyze the conclusions that he's made, etc. Anyway, his initial statements were that this LA physician was using hydroxychloroquine and zinc to treat patients with severe symptoms of COVID-19, and they were walking out of the ICU in 8 to 10 hours. Well, as I review the video from that particular physician from LA, he's an urgent care chief CEO, so they don't really deal with patients who are actually in the ICU. But he did describe the use of zinc with the hydroxychloroquine in the treatment of the patients and shows significant improvement in patients essentially being asymptomatic 8 to 10 hours. He described severe symptoms, but I don't know what that means because he didn't elaborate in the video. And he also cautioned about using it to treat people necessarily prophylactically, because it would actually impair the drug supply for people who normally need the drug, such as patients on rheumatoid arthritis or lupus that are beginning to have problems obtaining the drug because people have been prescribing it in a almost prophylactic fashion to have it just in case. Again, this is something I cautioned against in my earlier video, that we need to not do this because there are people that rely on this drug, and the president's national stockpile of 28 million doses, essentially if you are on 2 pills a day, normal treatment course is 7 to 10 days with the drug, essentially have enough to treat between 1.5 and a little over 2 million people who are in severe distress with the COVID-19. So even with the president's stockpile of the drug that's potentially available for treating patients, it's a limited stockpile at the current point in time. And then this physician, as he calls himself, from Missouri, goes on to relate that you could substitute quinine or tonic water for the hydroxychloroquine, and they're in a similar family of drugs, but they are completely different drugs. The quinine comes from a bark of a tree, I forgot what tree it is, and the hydroxychloroquine is synthesized in a lab. And there's been no evidence of quinine being useful at all in COVID-19 treatment. So his extrapolation of you can use quinine instead of hydroxychloroquine for the same result is patently false and potentially dangerous, because quinine itself, especially in the higher risk people who have either more obesity, diabetes with probable renal impact, older people with potential slightly impaired renal function, and older people with cardiac abnormalities, the quinine can actually be dangerous for them and can produce cardiac arrhythmias as well as renal failure and vision problems. So the statements that he's make are disturbing in a way, and I look at it from the standpoint of him describing quinine as allowing nutrients to flow into the cells and toxins to leave the cells, because he uses it to treat his patients with muscle aches. I've never heard of an MD using the word toxins being released from the cells. So that leads me to believe that the man is probably either a chiropractic physician or a homeopathic physician, and nothing against them, but their knowledge with regards to pharmacology is not as extensive as an MD, and I would say that him telling people to go out and do this is extremely dangerous, and if I was on the board of that state, I would probably look at pulling his license. In any event, hydroxychloroquine does appear to work, but it usually appears to work in conjunction with other things, whether or not it be the azithromycin. And there appeared to be, again, that anecdotal study out of LA right now with a small number of patients where zinc being used in conjunction with it is helpful. It being used solely by itself does not appear to be helpful. It needs to be used in conjunction with something else. So something obviously binds to the receptors and allows the hydroxychloroquine to do its job, where hydroxychloroquine binds to the receptors on the cells and allows the other agent to help out in the COVID-19. We really don't have a firm grasp on the pharmacology of the impact of those agents on COVID-19 as of yet. In any event, I just wanted to warn people out there that there's a video out there that is telling people to take quinine. Again, not the same drug. And please don't do that. Consult with your physician if you're going to try any type of experimental therapies, etc. And I will post some links down below to cover what I've discussed, as well as some other links discussing further advancement in the hydroxychloroquine front and possible prophylactic usages of drugs, etc. Anyway, have a good day. Thanks.